systems. So thank you so much, and great to see all of you. As a start, I'm going to ask Jesse Shapiro, who is going to welcome us to this particular session. I've known Jesse for quite some time now, can't remember how many years, but he is a WASH advisor and sanitation focal point at USAID. I know that he's also an engineer with immense experience in terms of either construction, water and sanitation infrastructure, policy development, behavior change, and all the different aspects, but mainly within the water and sanitation sector. At USAID, he's primarily involved with the new project development and, of course, leading an increased emphasis on sanitation, which is a big challenging issue we to address in this particular time. So at this moment, I'll ask Jesse to please go ahead and give welcome remarks and share some session objectives.
Thank you so much, Dennis. Among some of those roles Dennis outlined, I'm also the manager for the USAID WASHPaLS project, which stands for WASH Partnerships and Learning for Sustainability, which is supporting implementation research and learning to improve WASH programming globally. WASHPaL's main body of research covers several areas such as community-led total sanitation, market-based sanitation, and hygienic environments for infants and young children, and gender and WASH. In the early stages of this research project, WASHPaLS conducted a global review of market-based sanitation efforts. You can actually find the report of this review and webinars on it on USAID's water website, globalwaters.org. Just search for Scaling Market-Based Sanitation. In that report, we outline a framework for market-based sanitation that centers around a sanitation enterprise. And you can see that framework here on the screen. In that report, we examined several barriers across the sanitation market system that really were identified to inhibit scale. These range from micro barriers in the core sanitation market, such as lack of desirable and affordable products, or unviable sanitation enterprises that impact entrepreneurs, and macro level factors such as the ability of finance for consumers and enterprises. While sanitation programs have focused on resolving several of these barriers, a lot more still needs to be done to address these weaknesses. Today, this session, we're going to spotlight two critical missing links in the sanitation market system. First, at a macro level, the enabling environment, or the lack of institutional accountability for developing and implementing holistic sanitation-related policies. And secondly, at the micro level within the sanitation market is the need for demand activation as a distinct mechanism to bridge the gap between demand generation and activities and supply. Next slide, please. We have a host of experts joining us today to shed more light on these missing links. We will start with brief presentations that will introduce us to these missing links and why they must be resolved. That'll be delivered by Dr. Canisius Kanengeri, the Executive Secretary for AMCAL, who will explain the need for institutional accountability for sanitation, followed by Subhash Chennuri of the WASHPaLS project, focusing on demand activation in sanitation markets. We will then break out into two groups for a panel discussion. In breakout group 1, we have Dr. Al-Maid from the Department of Public Health and Engineering in the government of Bangladesh, Dr. Kanengeri from AMCAL, and Dennis Mwanza from RTI. In breakout room 2, we'll have Brooke Yamakoshi from UNICEF, Jeff Revel from Watershed, and Sanjay Singh from PSI India, who will share their experiences and approaches to demand activation. We will then reconvene for a plenary session altogether to share the highlights from both these breakout sessions. So on behalf of the organizers, we welcome our distinguished experts who joined us today to share their knowledge and experience, and welcome all of you from around the world. Back to you, Dennis, who will be your host today and take you through the rest of the proceedings. Thank you.
Thank you so much, Jesse. So without much further ado, I'm going to request Dr. Canisius Kanengeri to make a presentation. Dr. Kanangiri has over 30 years of experience in the water space with a lot of international organizations, and he's currently the executive secretary of African Ministers, Africa Ministers Council of Water, or AMCOW in short. And I think he's the right person to share with us on why we need institutional accountability and what that actually means. So Dr. Kanangiri, please, you have the floor. Thank you so much. I think you may need to unmute yourself. Sorry, can you unmute yourself? Yes.
Thank you very much, Dennis. I wonder if my presentation will be controlled from the other side, or if I should do that. Let me start. I wish to thank you first, Dennis, and the organizers of this session. And I would like to also commend the efforts of bringing people to discuss the many missing links, at least the most important ones. I will focus on the African continent and say that the state of sanitation in Africa, and especially in sub-Saharan Africa, is very much wanting. And of course, with the slow progress towards different commitments and target that we have subscribed to, most countries are almost doing no progress or very limited ones. And reasons why that is happening that way has been a key issue discussed during the last decade and even before. In 2018, for example, we had a very important milestone in the sanitation management in Africa, in ETHEKWINI, Durban in South Africa. And some of the reasons why all these issues are happening were discussed. And we can see that mostly in Africa, we have inadequate policies and strategies, which are hardly translated into policies, into plans, and plans which can be budgeted and then be easily implemented. And more recently, we at AMCOW did an assessment of 26 policies and found that most of them were not aligned to current commitment, be it the Ngor commitment taken in 2015 by African ministers, or the SDGs, which were globally committed to by also all the African countries' leadership. So this is somewhere where we find one of the biggest weaknesses, which may be hindering the progress that we want in the sanitation area. Those policies are not aligned to SDGs. They are aligned still to MDG. And when you look at the comprehensiveness, they still lack issues like legal framework, monitoring framework, regulatory framework, the financing part of it, etc., etc. So, and if they are not comprehensive, they can't address all the issues that we have. The second bottleneck that we have many times come to is poor financing. And there also, there have been a number of commitments linking it to a certain committing to put in sanitation a certain percentage of the GDP. But again, it has not been implemented, and there must be somewhere a missing link which justifies that kind of two-track, the commitment and the action which does not match with the level of the commitment taken.
Sorry, Dr.
And,
Kananja, do you want me to show the slides?
No, this is okay.
Okay.
And one of those issues is, again, one of those missing link could be indeed the weak institutions and lack of coordination, which is not in the coordination area. Indeed, you will find sanitation fragmented throughout many ministries. Some will have part of it in the health ministry, some in infrastructure, in housing, in environment, and it becomes difficult to put all those pieces together so that we can move in a more coherent way. And all those have led to a poor state of sanitation in Africa. Next slide, please. Coming back to the issue of institution. Next slide, please. We will find that, for example, in 2008, the effort of bringing together the countries to discuss all those bottlenecks and prioritize actions which would be required. They came in ETHEKWINI then, 2008, to a number of commitments that Africa would take to improve the sanitation space. Dennis, can I have the next slide? And if you look at the commitment that were taken then, you will find that commitment 5, and it says that ensure that one principal accountable institution takes clear leadership of the national sanitation portfolio. Establish one coordinating body with specific responsibility for sanitation and hygiene. That was the starting point of addressing that key bottleneck in the whole policy, the policy framework and the sanitation governance structure, with the commitment to have a dedicated institution that would lead and coordinate activities around sanitation in Africa. I will not come to other commitments which were taken then, but from 2008, when those commitments were taken, many countries in Africa started establishing a dedicated ministry of sanitation. Some of them did a ministry of water and sanitation, sanitation of water, sanitation and settlement, sanitation and housing, and the fact that sanitation was mentioned and the minister would give accountability on also actions regarding sanitation changed a lot in the way even the financial allocations were made. And it led to many improvements in those countries that chose to dedicate a ministry or a specific institution to sanitation. Some of the effects that we can talk about are that the leadership was more effective with clear policy, sound strategic directions, effective planning, and a dedicated budget. And that was very important to make sure that the agenda was pushed forward in terms of improving sanitation services. There was a better articulation and prioritization of sanitation in those countries. And that went with the financing. And that is crucial. And we are still fighting today to get more prioritization and more financing. There were more better built and stronger institutions with clear roles and responsibilities. And that is something very important. And also a strong coordination, a focused oversight. And all this was also like capped by a strong monitoring where you would measure the progress and document the lessons, and which will come and improve the decision making and the allocations the following years. This led to a better understanding of the needs of urban and rural areas and tailor their actions required to those needs. And it led also to an efficient use of the resources because the ministry became more accountable. And those can be noticed in some countries that took that kind of decision. Like Zambia, for example, where we have a Ministry of Water Development, Sanitation, and Environmental Protection. Like in Senegal, one of the countries which is doing very well, Ministry of Water and Sanitation. In Kenya, Ministry of Water, Sanitation, and Irrigation. In Ghana, in South Africa, and also in some other countries where the sanitation portfolio was given a high prominence in terms of institutional arrangement. We believe, therefore, that to improve the accountability and also improve the progress in implementing the commitment in the subsector of sanitation, we need a stronger institutions which will be accountable and which will bring the voice of the sanitation sector in different decision-making fora, like in the Council of Ministers, but also at a higher level at regional and continental level. I thank you very much.
Thank you so much, Dr. Kanangiri, for that very interesting presentation, talking about the challenges, but the recommendations that AMCAO promotes, which I believe would be for the betterment of the sector in terms of sanitation, having an institutional a ministry that is clearly accountable for for sanitation. Our next presentation is on demand activation. So if you look at this, what Dr. Kanangiri has said is basically at a higher level in terms of government accountability, institutional roles, and so on. But now we're talking about demand activation, which, as you saw from Jess's first presentation, had quite something on that. So this will be presented by Subhash Shenuri. Now, Subhash is an associate director with FSG, I believe that's a financial services group, which is a leading social income, not financial, it's a leading, I'm sure he can clarify further on what FSG stands for. It's a leading social impact consulting firm and project manager for market-based sanitation. He's a project manager in the, project for market-based sanitation in the USAID WASHPaLS project. That's the one which Jesse Shapiro talked about. That is partnerships for learning and sustainability. He's also involved in implementing research to improve market-based sanitation programming globally. So Subhash, the floor is yours.
Thank you so much for that introduction, Dennis. And yes, FSG used to be Foundation Strategy Group, but we go only by the name of FSG now. And good morning, good afternoon, evening, everyone, and thank you for joining us from all over the world. Dr. Kanangiri focused on the macro level factor of institutional accountability that in many ways we understand can shape the enabling environment for sanitation markets. we will now introduce a barrier that is often found on the ground within sanitation markets, and that is the household's reluctance to purchase toilets. And we'll look at how it is overcome in part through a concept called demand activation. Now, before we proceed, just like to ask, please reserve your questions on the Pathable platform for the breakout session, where we will be discussing this topic in more detail. And we do have a number of experts at hand to answer your questions. So to provide some context for this term and concept, let us first understand the practice of demand generation. Many sanitation programs feature community-based approaches such as CLTS, fast behavior change communications, and such approaches prompt households to alter unhygienic sanitation behavior primarily by ending open defecation. And these approaches have evolved over the years, initially with messaging about health to leveraging several emotional triggers. This could lead to some households forming an intent or at least forming some interest in purchasing improved sanitation solutions. But demand-side interventions alone were insufficient and triggered households needed solutions which were often not available. So in more recent years, programs have also incorporated supply-side interventions such as training local artisans to build toilets or contracting a local supplier or setting up sanitation marts or sani marts for fulfilling the demand that would arise in a given geography. While one would expect that with both demand side interventions and also making supply available or strengthening supply, that there would be that interaction and the sale of toilets would increase. But as many programs show, the results can be disappointing. In practice, raising awareness of a problem or its solution, which in this case is a toilet, does not necessarily prompt households to follow through with their purchase, or in other words, to act on their intent or interest in sanitation. This is because there are several barriers exist. As Jesse mentioned, there was an affordability or the low desirability of existing products. But even if one we were somehow to resolve the product problem or some other barriers in the market system, customers could still be reluctant for several reasons. Meanwhile, on the supply side, entrepreneurs who were persuaded by programs to participate in the sanitation market get impatient with low sales and they lose the motivation to remain invested in the sanitation business. So what's missing if we do have demand generation and we have some supply? So potential customers often need more than just awareness to purchase a toilet. Now let's, while we have shown this framework for a toilet, let's leave sanitation aside for a moment and look at another example. Say insurance, it could be health insurance or life insurance. Now, consumer education campaigns by government or by industry associations tell me that I need insurance. At some point, I get convinced and I think about getting one so that my family is secure, or if it's health insurance, then I don't have to pay exorbitant bills at the hospital if I fall ill or meet with an accident. But when I'm thinking about getting one, it is about getting one sometime. I keep putting it off, saying that I will do it when I have some more savings or when I have some extra cash. And 1 month I have to pay for my child's fees for the next quarter. The next month I find out I have to fix a leak in my ceiling, and it can go on. And clearly in this case, purchasing insurance is not my top priority. There is also another problem, which is I don't know what to get, how much insurance I need. what are these add-ons, which insurer. The information can be overwhelming until one day an insurance agent shows up at my door and helps me understand these choices. So if I say I need to think about it and I'll call you back later, believe me, they will make sure you're thinking about it with calls, following up every week. Once in a while, they'll probably throw in a special offer. They'll do that till they persuade you to buy one. Sanitation is no different. It requires some level of persuasion to get the customer to purchase a toilet. But the problem is that unlike insurance companies, from the example that I just shared, the artisan or local entrepreneur is rarely willing to or can afford the time or the effort to go around and persuade potential customers. So demand activation, therefore, is a missing link between demand generation and fulfillment. Now, in the breakout session in a room that we're calling Sani 2, we will have 3 experts who will share their experience and perspectives on how demand activation is distinct from demand generation in practice, how they might complement each other, and what roles are there for different actors such as sanitation programs and government. With that, I will now hand it over to Dennis. Thank you, everyone.
Thank you so much, Subhash. This is again another very interesting topic, and thank you so much for guiding us through that. We are now going to break into groups. Basically, we'll go into 2 groups. We have 2 groups. One is looking at institutional accountability, and then the other one is looking at demand activation. And as Subhash has rightly mentioned, we have 3 experts in each of the 2 sessions. And so I'd like you to, but we also want to use this session for, doing some exchange of any notes or any information that you might have, but also ask you questions, and we'll see how we can get on that. The way we're going to do it is that this room, I'm not sure if it will close, but we are moving out of this room. You go back to your website. I think that's what is, if you can see on the screen, and then click on the session that you want. We actually had a big debate on how we should divide ourselves, whether we do by surname or by age or by year of month of in which you were born. Until in the end, we said we'll leave it to all of you to choose between these 2 sessions that you go into. At an appropriate time, I think the sessions are actually 30 minutes long. At an appropriate time, we'll come back to the plenary, because we want to hear, like, for example, I will be in the accountability session. I want to know what has happened in the demand creation session. And then, of course, same with the other side. So we'll hear summaries of the discussions from each of these two sessions. I hope I'm clear in terms of instructions. Please go back to the Patabo, which is the website which led you to come here, and click on the appropriate session, and then you'll get onto the Zoom into the particular session. So please, we'll see you back in the next 30 minutes. Thank you so much.
If you have any questions, you are able to unmute at this time and you can ask, but if you return to their main session page where you joined, scroll down and select which breakout room you're interested in, wait for the new page to open, disconnect from this Zoom call, and when you click join in your breakout room, it will start a new call. If you are just coming in and wondering why it is so quiet in here, we have moved into the breakouts. Your choice is institutional accountability or demand accountability. If you click on one, a new page will open. Disconnect from this Zoom call that we're currently on and click join, and you will enter that breakout room. We will be returning here afterwards. Breakouts will last about 30 minutes. Hi, if you are still in this session and you're wondering why it's so quiet, perhaps you stepped away from your computer or were distracted, we have moved into the breakout rooms. And to find a breakout room, if you return to the session page where you join the sanitation market systems and you scroll to the bottom, there are two breakout rooms listed: institutional accountability and demand accountability.
To end this session, and we'll be joining back. We'd ask for your patience. Thank you.
Everyone, I hope we had, I need to change my host. I need to change my name. Yeah, I know that in this whole thing, just like it happens during the normal conferences, you still lose a few people when you go into sessions, and then when you come back, you still lose more, and you start wondering what happened. So people get lost and so on. But it's great to see you back, all of you. We are going to listen to basically two presentations, as I mentioned earlier on, that we will want to hear what was discussed in the different sessions. So I'll give just about 5 minutes to Rita to give us a summary of what you got from that particular session. Thank you.
Great. Thank you, everyone. Good to be back with the bigger team. I'll go quickly as we just have a couple of moments, but wanted to share what we had spoken about in the policy and accountability session. We followed up from Dr. Kanagiri's presentation about the government accountability and ministerial roles and the importance of having sanitation in this, highlighted so prominently. Dr. Dennis Malanza brought up the government and service provider accountability, and we really then focused the conversation more on non-sewered systems, as that's been most prevalent in a lot of the areas that we've been working in. And looking at the system through the full sanitation value chain and looking at who the actors are, who's responsible when it comes to containment by users, emptying and transport by private companies, or maybe treatment by municipalities. We then focused a lot on the regulatory and the role of the regulator. And the city, and this phrase that we all know about, city-wise inclusive sanitation, of not promoting a specific sanitation technology, but really the inclusiveness of this. We then moved on to a great presentation by Dr. Al-Mueed from Bangladesh, who then showed us an application to citywide sanitation. And his focus has been working in small towns in Bangladesh, and really that there's so many actors within the space, and how best to coordinate that. So he's part of the citywide inclusive sanitation FSM support cell that's really doing so much of this coordination and making sure that all of the actors are really working towards the national level goals, and has a really big emphasis on monitoring throughout all aspects of the value chain. Quickly, we had some really great questions from the panel, from the audience members. Thank you for that. We were talking a lot about, again, that role, as you put together the city-wide sanitation, you have the role of the ministry. Then what are also the roles of the regulatory agencies, and how do we support those regulatory agencies as well? So we had Dr. Kanagiri talk to us about the role that AMCOW is playing in making sure that the guidelines that different country and city programs have guidelines that are supporting folks, because we've seen that the private sector has done has moved very fast in terms of the in terms of service provision. But how then are we making sure that municipalities and that the regulatory agencies in these regions are also being guided? So some fantastic work by the AMCOW team in terms of that, and making sure that we're supporting the municipalities, but then also these emerging issues of sanitation workers and health and hygiene and safety promotion for them. Last bit just to touch on, we talked about, there was a question on monitoring and on finance as well. And so looking at again, the monitoring and finance needs to be for the full sanitation value chain. We have a lot of emphasis on fixed costs, but we need to be focusing also on operational costs through the chain. So very quickly, that was our session. Thanks. Turn it over to
Thank you.
the team.
Yes, great. Thank you so much, Amrita, for that brief. I will not go through it again. So I will now hand over to Rishi Agarwal, who is going to share with us what actually came out of the other session, which looked at demand activation. So I don't know if Amrita or somebody who's got the right to unmute Rishi, because I think he's on mute and is trying to mute himself. Thank you so much.
Right.
Over to you, Rishi. Yes.
Thank you, Janice, and thanks for everybody who participated in the session. So I think it was an interesting session, and started by reiterating the fact that it's not an either or. So we're not talking demand generation or demand activation. As Jeff said, if you look at the customer buying process, these are steps in encouraging a household to buy and use the toilet. And Brooke brought in an interesting point, which was about, it is more about who does what, right? So if you look at that from that perspective, it's a question of, while the skill might be different, for example, customer development versus business development, if you're thinking of demand generation versus demand activation, or approaches where CLTS has been a proven approach to demand generation versus market-based, or Sandmark, which has been for demand fulfillment. At the same time, there are some assets that can be leveraged. For example, the communication messages, which might have been developed for demand generation. Some of them have been leveraged successfully for demand activation as well. Two other points which came up was, Sanjay mentioned that context is important. For example, for their project in India, the government investments and substantial investments at that in Swachh Bharat Abhiyan led to a shift in social norms. But the lack of knowledge of products in enterprise led to PSI recruiting and training toilet motivators. And the other interesting context point came in response to a question, which was what Jeff mentioned, that the context also changes over time, right? So while at the early stage of an intervention, demand generation might be more important because nobody knows about the toilet. Over a period of time, as that becomes a norm, demand activation will become more and more important, because then it's all a question about fulfillment, and therefore understanding, connecting the household to the enterprise becomes more important. Again, in response to your question, one of the last points we discussed was around sustainability. And there the panel's view was that it is important that the program design starts with the intervener not becoming a major market player. While the growth might be slower initially, but we felt that it would be more resilient and would lead to a more sustainable, viable markets over a period of time. So those were the 4 key points that came out of the discussion. It's not either or. It's about who does what. Context is important, and for sustainability, don't become an impulsive intervener.
Thank you so much, Rishi. This is really great. And I can see that, I mean, just like our session, and I think even the other session, time was certainly a constraint because there's so much to discuss, so much to learn, and so much to also share. Because in all our rooms, I'm sure we had rich experiences of things that are working. And I'm hoping that we can somehow maybe maintain some way of communicating with each other on what we are learning as we're implementing different approaches or programs. So I think I've gotten quite a lot from this this session. You know, when we're designing this session with Subhash, because the organizers said, well, you seem to be addressing similar subjects, so why don't you combine? We said, how is this going to be? But here we are now. It worked very well because we look at one side on the you know, on the institutional side and the accountability side, and then on the other side in terms of the whole demand thing. So it's great that we agree on quite a number of buzzwords. Issues of sustainability is key in sanitation, because if we are to talk about continuous access to sanitation and changing the statistics that we have globally in terms of access to safely managed sanitation, sustainability has to be a keyword. And then, of course, the issues of affordability, inclusiveness, coordinated approach in terms of how, you know, whatever interventions that we have. And I like the word that you used, Rishi, that we should be talking more of being an intervener rather than being a market player. If you are, you know, into the systems, and the role of data. We gave an example in, you know, in the session where we had that for you to determine which one is most cost effective, whether you do a sewer system or, you know, on-site sanitation or a mix of the two, you need to have the data. What is the current situation? Whether it is infrastructure, institutional arrangements, you know, and then come up with all the economics, the affordability, the poverty levels, and all the different things that matter in terms of planning. So you come up with a mapping, and then of course, you know, as a planning tool. And then of course, it's not either or, you know, demand generation or what was a market, you know, market creation, so to say. So I think, I mean, obviously, there's a lot that we got from both sessions, and I want to thank all of you. Obviously, starting with the people that have contributed greatly to this session. Ari, who's been working behind the scenes very hard, and Rita. But also want to mention specifically, Jesse, thank you so much for having been part of this session. And then the panelists themselves, starting with the institutional side, where we had Dr. Kanangire and Dr. Aumoid. And then in the other session, which looked at the demand side, Brooke Yamakoshi from UNICEF, Jeff Ravel, and then of course, Sanjay. I hope I've not left anyone, but really I want to thank you all, and it's really been great. Just to mention that this room is actually going to remain for the next 5 to 10 minutes. So if we want to have informal discussions, I'm not sure how we can do it, but it is definitely available. If you want to say 1 or 2 things, or, you know, to ask a question and so on. So for now, I would like to say that the session is formally closed, but as I said, the room is available for us to continue having any discussion. But again, I want to thank all of you for your active participation. Thanks so much.
Thank you very much. Thank you very much for this.
Yes, thank you.
Thank you, Dennis.
You're welcome. You're welcome. Sure. Thank you. Yeah. Yeah, just to mention that you know, when I talked about what we have been doing in Nigeria, learning quite a lot. As I said, this is a USAID funded program on EWASH, and there's a lot because issue of access to safely managed sanitation in Nigeria, just like in a lot of countries in Africa, is extremely low, and we need to see how we can, we can turn the tide, so to say, because business as it is now is not sustainable. Yeah. So, okay, great.
If somebody does want to speak, I have fixed it so they can unmute themselves, or you can submit something through the chat.
Okay, great. Subhash, can you just say a bit about, I was trying to get a difference between market demand generation and the market creation. I think Rishi is the one who talked about it. What's the difference? Or is it that I didn't get the words clearly?
Market creation, I think those are two very different levels in itself. The generation is something that we have discussed at length, but I think what you might be alluding to is the need for getting that mechanism off the ground. So initially, if they're private enterprises, nobody's really doing it, then programs would probably step in. But reiterating one of the key points on our discussion, as Jeff will put it, was finding how do you minimize that footprint so that programs can exit from the market at the earliest, or at least transition that relationship to participants as market participants as soon as possible. So entrepreneurs pay for it. Sales agents work with the entrepreneurs without any external intervention.
That's
and simpler terms, thinking about telling individuals that you need vaccination versus making sure that they have access to vaccination, they know where to go, how they will get it, what does the vaccination look like. So that would be the activation to get a simpler health framework, looking at a market-based solution.
Yeah. Well, that's quite interesting. Yeah. In the urban space, of course, we were talking about whether scheduled dislodging is the is the only way forward. But basically, we were saying that that's not the only option. There are, of course, other means of helping reduce the cost of dislodging, especially the septic tanks as well as pit latrines. Yeah. Amrita, do you have any? Oh, Dr. Mead, would you like to say one or two things? I just saw you pop up on my screen, so I said, "Oh, hey, he is coming into the room."
Okay, no worries. Yeah, I mean, if we talk about the desludging cost, I mean, if we go towards the municipality governments end, probably that would be one cost. But the other part is how we create the market, as Subhash was mentioning. I mean, market for or demand creation so that people will come towards the city authority for emptying service. So affordability, number one, is an issue. We need to assess that how much pocket expenditure actually people can pay for the service. Number two is how frequent. Often we forget about this. How often, frequent the service can be provided immediate after we demand the service. So if there is a long time gap, long queue, like 1 day or 2 days, your septic tank will be overflown. Come on. So there is no other way, right? So I found many cases, interesting cases, that city authorities, I mean, people ask and demand emptying service to the city authorities, and they gave a scheduled discharging. Obviously, we always follow that after 3 days, the vacuum truck will reach to your home for the emptying service, but it will not be functional. So what happens in locally, sometimes the residents call the manual emptier and clean it. You see, so the demand creation and market, what Subhash has mentioned, I was trying to link up these two things. Probably one example I am referring here. So it's always demand creation is fine, and market creation and providing service. If you don't link up with the providing service, the demand creation and market, creation will not be functional. That's the 2 cents from my end.
Wow, no, this is more than 2 cents actually. It's quite a lot. Thank you so much. There's some Rita
Dennis, may
idea.
I share?
Yes, please, Aisha.
Yeah. Our feasibility study, Dennis, is assisted by USAID, and now we are implementing our septage management program here in Cebu City, Philippines. How we do it is that those who are connected to the water district, I'm from the water district of Cebu City. Those who are connected pays environmental fees to the water district for those who are connected to the water supply. But for those who are not connected, we are charging them for one-time service. So the system, the mechanics works that for the first cycle or for 5 years, that's the first cycle, they will be given a free dislodging entitlement, free dislodging service. Then the next time they do, they would request for redislodging. That's the time they pay. We have two plants now. The one is from the government, and one vital strategy would be is really for the government for policies. Or our Department of Interior and Local Government has issued a memorandum that there should be a mandatory dislodging for households, because you know why, we have our water supply is stressed. We don't have enough water supply. This is an island ecosystem, so which means to say one livelihood or one industry is the tourism industry. Now, if we fail our water quality, the tourism industry would also fail. But there are still that does not have any what do you call this, latrines, and another agency is handling that. The Department of Health distributes. So it's a system that somehow septage management would really need good data, like the number of households, population. That's very important. So somehow I think for other countries that we have in Southeast Asia or even in other countries, the USAID has really helped us for our feasibility study. And on the other hand, in terms of septage management, one issue there is the provision of land where to put your plant, where you have to put your treatment plant, and this could be from the government. The government could somehow allocate the land as per the policy that we have here in the Philippines, and the water districts operates. So in terms of communication also, communication is also vital, because if we are having like 150 cubic meters per day of for our contractor in the other side of the island, they are being tasked to come up with 150 communication comes in, because sometimes at one day they would only have about 60 cubic meters of of volume of septic wastes. So communication plays a great role in that. And another thing, one thing, if you look at our streets here, if you look at our communities here in where I am, we have big trucks, we have big trucks, big vacuum trucks, but it cannot go inside the small streets and the houses where they are. What we need are what would also be feasible is having small vacuum trucks that would cater to small households. So that's how we do here in Cebu City, Philippines. Dennis, back to
When
you.
you say big trucks, that's the ones which are like 12 cubic meters?
That's the volume is about 10 cubic meters.
Oh, 10. Okay, yeah, those are big.
10,
Yeah.
the big
Well,
trucks.
this is really great. I mean, again, we're getting more terminologies from Dr. Mohid when he talked about, yes, you need demand and then market, but then to marry these two, you need the service provider, services themselves to be provided. And the mandatory dislodging is another interesting approach. And obviously, if you do mandatory dislodging, you need to make sure that there is somebody who is actually going to dislodge. I still remember actually in one city in Bangladesh where they were saying, okay, we don't have a fecal sludge treatment plant. But then how do we make it mandatory that people should discharge? Because if we do so, where are these guys going to take this fecal waste? So let us first put in place the right, treatment, fecal sludge treatment station. Then after that, we must make it mandatory to to have this. So no, this is really great. Actually, it wasn't in Bangladesh; it was in Warangal in India. Any last minute thing, please? I know. Don't feel shy to leave if you need to leave. This is just an open discussion. Amrita, did you want to say something, or somebody else? Anyone wants to say?
The
Yeah.
last story, Dennis, another
Yes.
interesting story. I mean, small story. I mean,
Yeah.
usually the municipal authority demanded for the very big vacuum trucks, collection vehicle, right? I mean, 4 cubic meter, 3 cubic meter. So I found that, I mean, even that those small cities do not have the access road to enter 2 cubic meter of the truck, but
Yeah,
the
for sure.
mayor and the municipal authorities demand for the
The
very big
big-
truck because they want to display it in front of their office. That
yes,
carries
that's
the
right. That's right.
image of the
That's right.
mayor that
Yeah,
he
yeah,
can
yeah,
get many votes from the people that he did something for this city. So very
yeah,
interesting
yeah.
story.
That's very true. That's very true. Sure, sure.
And
Yeah.
sorry,
Amrita, maybe you'll
what
be
I
the
do
last
want
one.
to, yeah, just
Mhm.
mention is the importance, Dr. Almoid, you were talking about having a designated FSM unit, and I've seen that be such an impetus for growth and development in the field, but also the visibility of it. One of the areas that I worked in Sierra Leone was, helping to establish an FSM unit within the Freetown City Council, and then the work that we were able to do with the sanitation workers. So one of your last points on kind of I don't like this phrase, but destigmatizing or showing just how important this sector is, giving it that visibility, but then also putting a face to the people that are doing the dirty job of a sort. So I think there's a lot of importance that just this ministerial visibility, at the municipal level, and how we're really talking more about sanitation really translates into the cities and public considering this in a different light than they had before.
That's great. That's great. Thank you so much, Amrita. Yeah. Any other last minute contribution? Any last one before we can just end? Ari, do you want to say something?
No, I'm good, Dennis. For some of us, it's lunchtime. Not all of us.
Yes. Nicole, I think I see Nicole. This name, I can certainly tell that it's from Madagascar. Do you want to tell us something, Nicole? I don't know whether you need to be unmuted or you can. I think everyone has been unmuted, I think. Nicole, if you can hear me from Madagascar.
Yes, I can hear you.
Yeah, so can you tell us what's happening there?
Many things are happening here. We are as well testing this market-based approach on sanitation. And this session was very interesting for us because let's say it confirmed one of our questions about this concept of demand activation. Very interesting and helpful for us. Our goal is to set how to say sustainable market without any kind of subsidy. I am working with WhatsApp in Madagascar now, and this is one of our big projects here. Nice to hear you and to meet you.
No, thank you so much, Nicole, and great. Yeah, I know.
Internet.
Yes. I know WhatsApp is working quite closely in sanitation, especially in Tananarivo, but it's great to reconnect. So anyway, I think maybe we can end here unless there's somebody else who want to say something. Because I know that the other session is started. That's where you have this technology thing. So thank you so much. I'm signing off. I think the room will still be open, but I'm signing off. So thank you so much for your participation. It's really been great.
Thank you. And I'll actually end the meeting for all. Great meeting.
Oh, okay.
Thank you.
Thank you. Thank you. Bye now.
Take care.
Bye now.
Take
Bye.
care.